Many of us hear about attachments, but what exactly are they and how do they work? Although aligners were quickly adopted by the orthodontic community, they originally had difficulties rotating certain teeth, in particular cone-shaped teeth, since these do not provide a surface for the aligner to exert its push force. That is until attachments were developed, made from composite, tooth-colored material. Attachments provide the aligner with leverage to generate enough force to move the teeth. They have now indeed become so advanced that they are not only used for cone-shaped teeth, but for uprighting teeth, keeping roots parallel during movements, and a lot more. Let us see how these attachments are placed. These are your Eon Aligner attachment templates, which are used to place attachments. The attachments can be clearly identified and differentiated from the other aligners by the T that is inscripted on the side of the aligner. You will know when to place the attachment by looking at your attachment template, which will be provided to you by Eon Aligner, indicating at which step to place the attachment. So let's get started. Rinse the attachment template with cold water and allow it to dry. After that, test fit the fitting of the template on the patient's teeth. After the fitting, we then prep the teeth where the attachments are to be placed by cleaning them thoroughly. Prepare the teeth by cleaning the tooth surface, polishing, drying, and isolating the tooth. We then apply the phosphoric acid to etch the area where the attachment will be placed. Be careful not to etch the entire tooth surface, but only the area where the attachment will be placed. We then rinse and dry the area until a frost appearance is apparent. We then prepare the primary adhesive material on which we will place the attachment. Apply the bonding agent to the surface, drying it gently. We then light cure the bonding agent according to the manufacturer's instructions. Then we begin to fill the attachment template with composite material. You can use conventional restorative composite to fill the attachment template, or as in this case, flowable composite material. We recommend that you do not attempt to place more than 3 teeth per quadrant at a time. Begin filling the attachment template, taking care not to greatly underfill or greatly overfill the template, but instead slightly overfilling the template. Seat the loaded attachment template aligner on the patient's teeth, and then use a probe, tweezers, or dental instrument to apply gentle pressure around each attachment to ensure full adaptation. Then, light cure according to the manufacturer's instructions. Carefully remove the attachment template and inspect the attachment. We then use a carbide finishing bar to remove any excess flash material. Afterwards, we use dental floss mesially and distally to check the contact areas. Then, lastly, we insert the aligner into the patient's mouth and make sure that it is fully seated. There are a few tips that can aid when placing attachments. 1. Be sure not to place more than 3 attachments per quadrant at any time. 2. Having well-defined attachments is important for aligner fitting and can help the patient's tooth movement. 3. Deformed attachments are normally the result of an underfilled attachment template. 4. Excess flash may sometimes occur as a result of greatly overfilling the pocket.